Terri's really healthy, and I see her about once a year, and we do a physical. In May, she had her annual mammogram. All of her previous mammograms had been normal, and of course on this mammogram they noticed some calcifications, which led to a stereotactic biopsy.
They told me that they would have the results either Thursday or Friday. So I called the doctor's office, and she says, "You've got breast cancer." I thought, gosh, how do you tell your child? Or my parents?
The next thing we needed to do is get her to see a surgeon as soon as possible and, kind of progress on with her care.
They tell you what type of cancer you have, and then they tell you what options you have for surgery, and then the decision's up to you. That was a tough decision, to make. What do you do? Jen Witt kind of held my hand through the whole decision-making process, and she can make a real bad situation good.
Jen Witt is a care coordinator at Stoddard Cancer Center, and she worked with Terri in coordinating her care.
She came to visit me through every chemo treatment, was there for surgery, and
basically my role is to really serve as an advocate for patients and their families. It was more for Terri being the one person who kind of could see the whole picture and at least be able to say, if you have a question about this, yes, this is who you want to get back to as far as your medical oncologist.
The whole idea is you want continuity of care. You don't want anything falling through the cracks. So it's real important to make sure that everybody has all the pieces.
My care here at Stoddard and through UnityPoint was wonderful.
For Terri, I think everybody was a team player. Everybody worked together.
My state of health today is very good. If I had put my mammogram off, I would have probably been in really big trouble.
Nobody thinks they're going to have breast cancer. And so it's very, very important that every woman has a mammogram yearly after the age of 40.
Prevention is key, and when we can catch things that are early, we have high cure rates, and that's what we want to have for all women. It's a privilege every day to just get to be with patients and families who are facing cancer, and in any way find ways to help bring something positive to them or help them through something that's so scary and overwhelming. Terri met it face on, and she rallied when days maybe she didn't feel like it. She rallied around the people, though, that gave her that strength, and she just kept living her life. That's why she was successful. So cancer had no place in somebody like that.
My success was based on the treatment here, the wonderful treatment here.